Often people are suffering from anxiety and have different traumas and things kind of going on and don't really know where to start in the community. So as a link worker, I'm able to listen and understand and give that good conversation about what that person is looking for.
Actually seeing the patient come in initially, genuinely empathising with them, gaining their trust, and then supporting them with things that's going to improve their physical or mental health.
They will often identify a need for a particular service. So they really are those essential connectors in their local community.
The job has become a lot harder. Certainly what I hear from our link workers is that they're really firefighting with the basic needs. That needs to be valued and hopefully influence some kind of policy that can tackle these things.
We need a long-term commitment so that the people who work as link workers can get the stability they need to provide the best service, and so that we can, as a practice and as a health service, plan around patients getting that help that they need.
If we are truly to start tackling health inequalities, we need to provide a workforce that feel confident that they are delivering the role that they're supposed to do. They're delivering it in line with what the government's requirements are. But what we don't have is a framework around us to be able to confidently move the service forward.
It would give enough flexibility that it would be adaptable to the different demographics and the different populations that we all work with. There would be some commonality so that everything we did across the country was measurable.
I would be looking at more upstream funding to sit within primary care, but also within third sector services who are crucial to the work that we do.
The benefit of the network is really bringing all of the community link workers in Scotland together to be able to learn from each other, peer support, share good practice. And I think as well the highlight of being part of the network is our annual conference where we bring link workers together in person from across Scotland.
The network has been fantastic, just having a larger network. So we're based in Orkney and we don't meet face to face very often. This is a great opportunity to do that. It just feels like it makes you part of something bigger, and having that peer support, but also that external support.
So I think the most rewarding part is really seeing people make positive changes in their life and really making positive choices.
Working with an individual and seeing them fully getting to grips with what they can actually do to improve their health and well-being.
When patients initially come in, they're maybe lacking a bit of hope. And I think as you start to support them, you start to see a shift where you're supporting them to work towards their goals. They then regain a bit more control over their situation and ultimately over their health and well-being.
The community link workers, the system, they've given me, they've given me back a big part of my life.
Sometimes it's not even about looking for a result or the cure. It's just having somebody to speak to.
Get the word out, because I didn't know what a community link worker was until I came into primary care. Didn't even know they existed. But they're just such a resource, and they're just such an integral part of every practice team. Every practice should have one, and they should have one for more than one day a week.